So today I'm going to teach you guys how to don sterile gloves and how to remove them. So you first want to begin by performing hand hygiene, so wash your hands with soap and water. Make sure you keep your hands above your waist because anything below your waist is considered contaminated or can potentially become contaminated because it's no longer really in your sight. Then you want to identify your patient and go over the procedures with them. So one, like you have the correct patient and then you have the correct procedure, and then it reduces any anxiety that they may have about the procedure. Now you want to make sure that check the expiration date on your gloves and make sure that they're not expired. And also you want to check to make sure that they're dry and then that your surface that you're going to place them on are dry so that they don't become contaminated. Open the package from the top two flaps and then remove the inner package. And then you're going to open it like a book with the cuffs facing towards you on a surface that's at your waist level or higher, because anything below that is considered contaminated. You want to now lift up this top cuff, and you want to be careful not to touch the inside of the sterile field because then it can become contaminated. But you are allowed to touch the 1-inch border because that is considered or thought to be contaminated. Now you can open it up and then you can adjust your sterile field using the 1-inch border so that the paper does not get in your way. Now you want to first glove your dominant hand. So you're going to pinch the cuff for the glove of your dominant hand using your non-dominant hands, and then you're going to slide your hand into the glove. Okay, so now you're going to take your pinky and anchor the glove and use your finger to anchor down the paper so that the sterile field does not move, and it's easier for you to slide your 3 fingers under the cuff, and you want to keep your thumb out. And then you're going to lift up the glove so that you can now insert your hand into the gloves, and then you got them on. Now to take them off, you want to take your non-dominant hand, pinch the cuff, and invert the glove so that you do not get any of it onto your hand, the contaminated side onto your hand. Now you're going to take your fingers and go underneath the cuff, and you want to ball up this first glove into your hand, and then you're going to pull it and invert it so that the second glove is now, or the first glove is now inside the second glove, and there you go. And then dispose of it, and then you want to take off the rest of your PPE and then perform your hand hygiene.